Right, good evening, ladies and gentlemen. Sorry to disappoint you, but you're going to have to take me for a while. I haven't done this for years, so I'm not quite sure what I'm doing. Right, welcome everyone. What do we do first?
Call for apologies for absence.
Right, apologies for absence.
Thank you, Chair. We've got apologies from Councillor Fry, who's been substituted by Councillor Skeppelhorn, Councillor Latif, who is substituted by Councillor Amjad Ali, Katie Thompson, the primary rep, Mark Mailer, the secondary rep. Apologies for lateness from Councillor Bridgen and Tasleem Assam, and Councillor Nasser, who's been substituted by Councillor Chowdhury. Thank you, Chair.
Do I have to read this out now?
Oh,
yeah. Right. The meeting this evening will be streamlined to the public, or live streamed to the public. A recording of the public part of the meeting will be available on the Council's website within 24 hours of the meeting. We'll promote participants joining the meeting using Teams. Please turn cameras on when speaking and use the hands up icon to indicate a question or comment. Turn microphones and cameras off when finished. Those in the chamber, please remember to switch microphones on when speaking and speak directly into the microphone and turn off when finished. Would attendees in the chamber please switch mobile phones off or place on silent mode. If you need to make a call, please leave the room and return when finished. Right, what's next? The minutes.
The minutes of the meeting.
Right. Item 2 is the minutes of the 30th of April at 6 p.m.
And the 20th of May. Two sets, Chair.
Are we doing both together then?
Yeah.
Oh, all right. Also, the minutes of the 20th of May. Does anybody have any comments, queries, questions? Okay. Do you all agree to these? Or somebody say something? No. Right. Right. Are there any disclosures of interest?
Community Governor at Dallow Primary School.
Is that? Sorry.
Hi, Parent Governor of Wigmore Primary School. Thank you.
Is that all? Thank you.
Chair.
Is there any urgent business?
Not being notified of any, Chair. Thank you.
Are there any chairs updates?
Sorry.
Wait, Terry, do you not need to declare your disclosures of interest?
I don't have anything to declare anymore. I've been fired.
Councillor Ali.
Councillor?
No, I just thought you were governor now, so I said to update.
No. Do you want to sit here? Right, okay. Chairs updates, none. None?
None, Chair, no.
Right then, we'll go into item 1, or item 7, which is Luton Child Health Weight Pathway and Resources. Manisha?
Hi Chair, thank you. Matthew Hudson standing in for Manisha today to deliver the report. So I've provided the report. I haven't had a presentation for the board this evening, but I will give a brief introduction to the report and then open for discussions, if that's okay, Chair. Cool. Thank you, everyone. So as you can see in the report and the associated pathway and resource, this has been updated in accordance with changes to NICE guidance, which were issued in January 2025. And equally, it signifies a change in an approach locally as well in terms of how we are looking to better tailor our services and our approach to our community to use a strength-based approach to understanding where our families and our young people are in terms of how we can provide the best level of support and at the right time, and also looking to support the delivery of our building blocks of health, so in terms of a health equity town, how we make that a reality through this sphere of work. As part of the development of this piece of work, we commissioned the University of Bedfordshire to conduct a review of our children and young person weight management services underneath the Talk, Listen, Change banner. So the three key themes that emerged from there was around communication and awareness of the services that are available, removal of stigma and being more inclusive, and removal of barriers to participation. So as part of that process, we've made some changes in how the pathway is developed and how it flows through to ensure that we're able to be more flexible in our approach and we're more holistic and compassionate in how we refer individuals into the pathway. In terms of strengths and opportunities that we've recognised as part of this process, there's a couple of opportunities through maternity and through SEND as well. So we've taken an action as part of this development of this pathway to develop two bespoke pathways which will be attached to the children and young person pathway. One will look at maternal services and how we're providing the best interventions and support for expecting mothers, where we know obesity in particular can be a concerning factor which can lead to more complicated deliveries, and we've also noticed an increase in C-sections and things of that nature where weight is considered a factor in that as well. So we're taking that away separately as part of this. And equally on the SEND provision side, although there are services available, we want to do a more in-depth analysis and consultation, co-design, co-production piece with the Parent Carers Forum locally, so with EPIC and with other service users, to understand the lived experience and how we can better tailor services to meet the demands of that specific population group. So again, in terms of the NICE guidance changing, it's afforded us more flexibility in how we deliver services locally. Some strengths which already exist within the pathways, the total wellbeing service and the flexibility we have in there. We've already made some adaptations to how that service is delivered. We're also piloting a service with Luton Town Football Club Community Trust, which is called Healthy Hatters, and that's looking at what we're framing as a Tier 2 Plus model, which looks to provide a slightly different service to the traditional 10 to 12 week programme, which is what was traditionally and previously and historically recommended by NICE. In terms of ICB collaboration, we're working on how we almost dissolve the tiering system to enable further flexibility in terms of people accessing services at the right time. We're in collaboration with Milton Keynes, who are also delivering a Tier 2 Plus pilot, which is more medical in its basis, so we'll have some further information on how both pilots are going in the future. We're also keeping in contact with ICB around pharmacology, which links more to adults, but in terms of tirzepatide and other pharmacologies available, the implications and the communication piece around those, and equally how it can be more innovative in our approach. And then finally, just as a reminder for the board this evening, this document is one which is meant for health professionals and clinicians in terms of supporting them to ensure that they're referring individuals into the right location so they can receive the right level of support at that time. Once progressing from here and once adopted, there will be a launch event to support the communication of this new pathway, as well as support through a training plan. We also have plans in place, as you'll see within the report, to monitor and evaluate the impact of this pathway to ensure that it's having its intended or reaching its intended outcomes. Thank you, Chair.
Right, thank you. Clarification on my part. Is this an endorsement or a new pathway?
So it's we're refreshing the pathway. So we did have an existing children, young person, healthy weight pathway. We've just updated that in accordance with the new guidance which has come out. So we're looking for endorsement from the board tonight for adoption of this pathway, which will be taken to Health and Wellbeing Board.
So this is an update?
Essentially, yes.
Yeah. Right, okay. Anybody got any questions at all? Please.
Thank you for the report. It's really clear. Figures are quite stark as well, actually, unfortunately, aren't they, really? So more of a question of, so it's good to know that there's going to be a kind of a multifaceted approach to tackling this. Given the figures are so stark, do you know if there's going to be any additional funding available to support the activity to address this, recognising that there's close links to poverty, linked to obesity rates, etc. So it's not just a local authority perspective, but is there anything else that we can tap into to support this activity?
Yes, thank you, Councillor, for the question. Absolutely. So through the public health grant, we've attributed more funding into healthy weight for delivery. So we've done that. We also have the existing resource in the system in terms of the services which are provided through Total Wellbeing currently. As part of, outside of this pathway, we're currently developing our delivery plan for healthy weight, which looks at coordinating the system approach in terms of how we can unlock other resource which currently exists within the system to enhance that. I think one of the key elements, and as you say, in terms of it being quite stark, is then how we also lobby towards central government in terms of more pressure and sort of guidance around how they can strengthen their policies centrally to help us at the local authority level to have more stringent responses to hot food takeaways, etc., things of that nature. So we have really positively seen an update of the National Planning Policy Framework, which has given us enhanced powers to refuse hot food takeaways which are within 200 metres of where young people may congregate or schools. But we need to go a step further than that. So in terms around advertising policies and bans, which has been delayed from central government, from the previous government, and now sort of into this government, we're waiting for further guidance on how that's happening. Obviously, as a local authority, we've adopted a healthy food and drink advertising policy, so we've got more control over our advertising spaces where we restrict the advertising of hot food or foods high in fat, sugar and salt. However, I think as our delivery plan will allude to, what we need to do, I think collaboratively as a council, is how we deliver Health Equity Town. So the association between obesity in particular and deprivation is very clear. It's very clear and well evidenced that exists. So how we deliver Health Equity Town around those building blocks and those wider and social terms of health around poverty, education, housing, etc., how we enhance and improve those circumstances will lead to that. So that's where I think beyond providing services for people who are already, or for young people already experiencing or living with overweight and obesity, we're trying to enhance that through this pathway. But outside of that, that prevention piece is where we need to focus more of our time and our investment.
The chair is here, but I'd like to ask you some questions. Carry on.
Carry on. Yeah, I'm not
right. Okay. Page 13, it says that on the top, nearest neighbour comparison. We're one of the lowest in the area for obesity. Also, the 42% of 6 children aged year 6 children in Luton are overweight compared to nationally. Why?
So in terms of our ranking, when we look at statistical neighbours, so we don't really, in the region, we're the worst for the region in terms of prevalence of overweight and obesity in year 6. In terms of statistical neighbours, we perform slightly better, but are still not the best. So that in terms of how we compare against other areas which have similar challenges to us, obviously within Luton in particular, we tend to compare ourselves to Slough, as it has London pressures as well. But we're all performing quite similarly. There's not a significant difference between us in terms of how we're doing there. So that just reinforces that this isn't unique to Luton, in the sense of this isn't just a Luton issue, it is a national issue where we're all trying to find the solutions in terms of how we can either halt. And one of the things that we've noticed with our data is actually for year 6 is we've not seen a significant increase in the prevalence of overweight and obesity for a number of years now. So over 5 years we've maintained that in terms of the statistical significance and change, although the trend would suggest we are slowly creeping up. In terms of why we're so different to the national average, again, is generally to Luton's demographic and the disparities and inequalities that our residents face. So when we talk about health equity town side of things and what's happening in that space and Luton 2040 and poverty and what we need to do in those areas, if you think around the services that we have in place, so through total wellbeing, will play their part in helping us to maintain our position as it has done. So we're kind of stagnant in the sense of prevalence. But what it's not doing is reversing that. So it's not going far enough to reverse that. And generally that's because although when people engage with a service in that intervention, they may be motivated and able to do things. But when that intervention and that accountability, say, falls away, the environment in which they live, work, go to school remains the same. So in essence, when we're asking people to maybe be more physically active, for example, or to eat healthier foods, if they don't have the means to do that already, so they don't have, say they're struggling with food poverty or food insecurity, or cost of living is causing an issue and they're having to reduce the amount of activity children can do, so they can't afford club memberships, things of that nature anymore. Those issues aren't resolved through attending the intervention service. So what we're suggesting through our delivery plan, and this kind of separate to the pathway, is how we provide better support for individuals when we engage with them. So we may not always be discussing weight as an issue, but what is the current family circumstance, looking at a strength-based approach. So what's working well, what isn't working so well, and how we can provide better support, such as through Luton Supporting You. So where there are maybe benefits or opportunities for further support for other services, we need to do a better job at linking individuals through that, regardless of whether they're being referred to us on weight. So it's not unique to Luton. It's an issue that's happening nationally, but it's very clear that, as we're saying, deprivation is a clear indicator for that, but equally those building blocks of health, those wider and social determinants, we can't simply focus on individual behaviour anymore because it's not worked. We've tried that in Luton for a number of years now, and it's not having the impact we need it to at population level. So we need to go back up the stream, if you will, and have those upstream interventions where we're stopping it happening in the first place. So where we can build upon all the fantastic work that happens up to reception, where we're performing better than the national average, so we're in a much better position there. How can we extend that through to our 10 to 11-year-olds at year 6? So it's taking those good practices there, but then extending that through. So it's a hard one to answer because there's lots of factors at play which contribute to obesity. It's not a simple sort of behavioural issue. We need to really, as sort of alluded to in the previous response, focus on those social determinants, those building blocks of health, and making people's lived experiences easier for them to make healthier choices.
So what you're really saying is that the past plan wasn't working properly.
It's not so much that it wasn't working, it wasn't having the level of impact that we wanted it to have. So in essence, where we've done a review on our Tier 2 services, so our community weight management services, they are helpful and they support a number of people, but not on the scale that we need it to. We just simply can't get the numbers through the service to support it. And as I say, when they then come out of that service, what we're seeing, and this is what NICE has recognised as well nationally, is that the data isn't strong enough to support Tier 2 weight management interventions for children, young people and families anymore, because after 12 months, they revert back to where they were prior to the intervention. So they regain any weight loss and they're continuing to then, we'd use the term as obesity remains progressive, so they continue to put weight on. And that's where we're seeing increased incidence of childhood diabetes, etc., and things of that nature, because we're not solving the causes of the causes, if that makes sense. So we need to refocus ourselves back on those upstream interventions, not to, so as NICE have said in their guidance, it's not to say, they thought it too radical to say not to say they can't recommend Tier 2 weight management services anymore, but it must be combined with a health equity town approach to enable that system change.
So you've taken these new factors into account, have you, into this?
Yeah, absolutely. And what would be useful is, I think, Chair, at a future date, if we could bring the delivery plan for healthy weight to this board, so you can see in terms of where we're looking to take further action across the board in those different spheres of influence and causal factors for overweight and obesity, so there's a better sense of the other pieces of work at play, which I feel will give more of a comprehensive picture of what we're doing in response to changes to NICE guidance and basically the review and understanding that we're not having the impact at that population level that we want.
So we can look forward to a reduction in the obesity in your next report to us.
Yeah, absolutely. Yeah, I'll work with Marie to get on the full plan.
I trust we get that minuted.
Thank you.
Skebbelhorn.
Thank you, Chair. A couple of things occur to me. One, when I went to school some hundreds of years ago, I walked or cycled. Many children, even in primary schools, are now in schools a long way from their homes and therefore aren't in a position to walk to school. But even those that do tend to get put in the back of mum or dad's car and driven to school. On top of that, we have e-bikes, e-scooters all over the place. Nobody's actually exercising anymore. Even if they're on a bike, they're not actually pushing the pedals round. And how do you deal and address that? I know a lot of schools have introduced the walking bus, but if you live the other side of town, that's not going to come and help you get to school. And the other thing you mentioned about fast food joints, there's the practicality of the planning rules. If it's already there and somebody wants to carry on, it's near impossible to prevent them from continuing to be a fast food outlet. You may be able to stop brand new ones, but anything that already exists within the code frame for swapping to fast food from whatever type of other outlet it was, you are virtually impossible to stop those. So something needs to be taken higher than here and back to government to look at planning rules, especially for any new developments that come along, that including potential fast food outlets needs to be far more restrictive, because otherwise you can do all of this and you're not actually going to put any dent in the problem.
Yes, thank you, Councillor, for those. So I'll try and take them by bit in there. So yeah, absolutely, and that's recognised, I think, within Luton, particularly how urbanised Luton is in terms of walking and cycling and the infrastructure that we have around the town, and that's something that's certainly of key interest for colleagues in transport, and as part of the local or Luton Transport Plan 5 and the review of the local plan, is those issues are being picked up within those, and how we can leverage in funding from Department for Transport, for example, to enhance where we have those things in place. One thing that we are doing with transport colleagues is exploring school streets, which is the temporary closure of through traffic to roads around schools where they're not on bus routes, for example, so that will better facilitate or enable, hopefully, parents to park maybe a little bit further away and then walk, scoot or cycle in part of the distance. But rightly, as you say, in terms of just, I think, how society has changed, and the two working household now, where both parents are generally expected to work or need to work. And again, that kind of plays its role where I think after reception age years, so those primary school age years, as you say, we're seeing probably more parents relying on cars to get the kids dropped off and then go on to work potentially. So it's, in terms of how society has changed, we are living in a more, what is generally phrased as an obesogenic environment, which is anti-health. So we're promoting anti-health through what we've created over a period of decades. And that's generally recognised through central government policy as being largely unsuccessful in the weight sphere, because its policies have promoted the opposite in terms of how we want to do that. So now it's a case of how we can reverse that in a shorter period of time. So I completely agree with you in the sense that we need better lobbying, stronger policy, stronger positioning from central government on how, in terms of providing stronger powers locally for us. Just for reassurance purposes, we do respond to every hot food takeaway application we receive as a public health team. So we always put in a refusal towards any hot food takeaway. That's using National Planning Policy Framework, which was only recently updated, which gives us stronger powers, but equally utilising, referring to our food plan and our obesity statistics and the already high proliferation of hot food takeaways we have across the borough. And you're also correct in the sense of we need to establish a better working arrangement with existing hot food takeaways and how we can make them more socially or culturally aware of in terms of how they're contributing to massive health issues. We have previously had Tuck-In, which is a pledge system essentially for hot food takeaways to pledge towards some health outcomes in sense of providing or using different cooking oils or lowering sugar in their ingredients, removal of sugary drinks from meal deals, things of that kind of nature. We did unfortunately decommission that as part of, in response to the pandemic, but it's something we're exploring of reintroducing into Luton. Working with licensing, as I said, planning officers in the local planning, strengthening that locally. We want to develop a good food charter for Luton as part of a food plan work that we're looking at currently as well, which will enable local businesses to sign up to. There is a commercial element of that which we are conscious of, where some of these establishments are supporting local residents and their families in terms of an income, so we have to bear that in mind with this approach. But there's still quite a lot we can do in that space with the existing ones which we have. And rightly, as you say, once they are in planning to speak those hot food takeaways, it's hard then in terms of conversion away from that. So there was, for example, if one were to close and we had easier planning permissions to turn that into a place of residence, say, that would help us from a housing issue as well. So there's lots still to explore in this space. But we are doing what we can within our powers currently. But I completely agree with remember that it's, we do have to put and lobby to, our MPs and central government around what more can they be doing to support us at this level.
Councillor Bacon. Oh, hello. Paul, go on.
Thank you, Councillor. Just in response to the point about children and the school placements, I think our latest data for this year shows that 99% of children in primary and 96%, just over, of secondary received one of their top 3 choices. So working hard to make sure it's the closest, nearest school, and certainly within the top 3 preferences. But obviously we still need to encourage families to use modes of transport, working in collaboration with public health and getting that education out there about the importance of healthy lifestyle choices. But just wanted to pick up on that point.
Thank you. Apologies, I was stuck in all that traffic. It's always when you get to Luton. Anyway, I don't know if you've already covered this particular point, but as I read this report, I was quite actually interested to hear a little bit more in terms of the figures. So where you're talking about, obviously, primary school children, we are focusing on Luton, and you kind of match it nationally to kind of do a comparison in terms of the figures. What I'm interested in is, with the figures that you have, when you're measuring obesity and so on, and the BMI and all of that, are you looking at ethnicity of the child? Are you looking at gender? If so, is that data available to us? And can we compare it to a similar town where we have the same sort of demographics? Because obviously we know that ethnicity is really important in terms of determining what your body shape is going to be, whether you're going to get type 2 diabetes and other sort of health conditions. So we know for South Asians are predominantly at higher risk than perhaps some other ethnic minority groups in terms of getting some of these conditions. So I just wanted to know, what evidence do you have in that sense? And have we, I mean, we're talking about takeaways and this and that and the other, but sometimes whether you have a takeaway or not, or once in a blue moon, doesn't always make a difference because of your own genetic composition. So again, it's kind of, are we looking at those factors? Because South Asian people are at a higher risk in general anyway, and then there is that lifestyle matter. The other point I wanted to pick on is actually with regards to green space availability. So we have a lot of families that are in flats, in high-rise flats, or in sort of other types of accommodation where they don't have access to a garden. Sometimes they might have a front garden, but they don't consider it safe for their children to play in that front garden. So again, in terms of green space availability, do people have access to green space? Because I know there's a lot of studies being undertaken at the minute on green space and its connection to sort of certain diseases like diabetes and also life expectancy, because these are, we're talking about the future here, and it's kind of, we're already projecting that they're not really going to live longer than sort of your 60, 65-ish from the data that I've personally seen in terms of my own research. So I'm kind of thinking, if I'm to project in, say, another, I mean, for example, 2040, life expectancy is going to drop. It's expected to drop, and given the fact that there is the rise in costs and cost of living, people may not have the option or the luxury of wanting to cook a healthy meal, because basic ingredients are now really, really expensive. So I just wanted to, first of all, know about that. I have got a couple of other questions, but let's see how you get on with that first. Thank you.
Thank you. I've tried to note them down, so I'll take them at each one, and if I've missed something, please do remind me. So in terms of the data aspect, yeah, absolutely. It's one of the areas through the National Child Measurement Programme where school nurses try and weigh and measure every child in reception in Year 6, where we're actually quite data rich. So that really benefits us. We've utilised that, and we have a healthy weight needs assessment which we've conducted, which looks into all that data in much more detail. And I think that links back to the Chair's, Councillor Keane's point earlier around just bringing some further information. I think in the wider context of things, I'd be more than happy to when we come back through, to bring a more comprehensive report on that front. And equally, we're in between that, be more than happy to share the needs assessments with the group as well, so you can look at that data in your leisure as well, and look into your specific wards, etc., around the data for those. So we're more than happy to share that with you all. The issue around green spaces is one we're aware of. In Luton, the green spaces we have left, which are available to us, are very precious, and I think the council's policy position on that is very clear, that it's not for building on. We're going to maintain it, we're going to look after it as far as possible. As you say, it is in certain areas of the town, it's more accessible than others. As part of a way we've looked to support in that essence of providing a safer space closer to home is we've introduced the Play Streets policy. So that's a free initiative to residents where they can apply. It essentially follows the same principle as a street party, where they can apply for a temporary closure of their road to through traffic, which will enable, they would have to marshal it in terms of it's volunteer based and things. So the postman, Amazon and things can still access if they need to, but in essence you wouldn't be allowed to cut through there as a bit of a rat run. And then that provides a space, an opportunity for families and their children to be more active closer to home. We've got a couple of play streets happening this year. We've done a few on St Monica's Avenue, which have been very successful, and we're due to bring, because it was a pilot initiative to start with, we're due to bring a paper back through to Council Executive to formally adopt that policy. But anyone can apply for it to have a play street. They just need to engage with the local community on that street and do that, have that in place. Other things around Chalkscates, which is a project which was done a few years ago, spoke around pathfinding and access to green space. So particularly because we're surrounded by areas of natural beauty with the Chilterns, etc., and off over Stopsley Common, all those things, and how we can better engage with particular diverse communities and accessing that space. So there's an ongoing piece of work. Then we've just completed another funding bid to support that. So there's an ongoing piece of work there, and be more than happy again to share that information so you have that. And completely agree in terms of access to food. We know food insecurity is a massive issue, particularly in Luton. We know people do have to make difficult choices, and some are on that on the cusp of crisis, where they rely on food banks or are relying on food banks, whether that's through Luton Food Bank or through schools or whatever means, or other faith or community groups which provide hot meals or food availability as part of their faith. So we're very much conscious of that, and what we are looking, or what we will be doing, is developing our bid to be a sustainable food place, which has 3 levels of awards, but essentially part of that is developing a food plan for Luton, which is held and led by the community, so through the Luton Food Network, which was established as part of the Luton Sport and U piece, where if you go into Sport and U website, put your postcode in, it'll provide you with options of food availability. But in terms of where we do have green spaces for growing and like edible landscapes, that kind of thing, like we're seeing with in Hightown and within Farley as well, so looking to expand that as far as we can.
Yeah, sorry, can I just butt in there? The family hubs, as you just mentioned, would it be not a good idea if we were told where they are, when they are, so that we can, all of us, councillor-wise, inform people where they are?
Yeah, I'm happy to take that if that's okay, Chair. So our family hubs, we've come a number of times. We've got our maps of our family hubs that have come when we've presented. So we have 3. We've talked a number of times. We had 4, two hubs and 2 spokes, and we're just about to open our 3rd hub in the library. So I'm happy to bring that as a separate item, and obviously the work that we're doing, you know, we work really closely with the Healthy Weight team and a number of the projects that are shared across.
I'm a bit concerned, they seem to be all centralised.
No, they are Parktown and Hockwell and other hubs, and we have Spokes, Pastures Way and Fox Cubs. So I'm happy to kind of bring that. I don't have the map to show you right now, but I'm happy to bring that as a, you know, another time to discuss where our family hubs are. But we run a huge amount of outreach. I think when we talk about family hubs, we have a really strong outreach model. So we have outreach really in pretty much every ward, but certainly in every neighbourhood.
Right. Yeah. There's nothing seems to be in the Stopsley area at all.
Yeah,
Why?
we picked this up at the last time when I think when we brought family hubs, and we did. You suggested a number of sites that we have looked into, and we're happy to come back to you. We can come back and have that discussion. We have looked into. You talked about Morton House that we have looked into. We've talked about other places. So we are constantly looking at where we work, but what works really well with the Central Library is access is really good into Central Luton, so it gives us opportunities to engage with a really wide part of the community, because people can get into the centre quite easily, most people, but what we also have is this outreach. So we do work in Stopsley, we do work in Vauxhall, we do work in that part of the town. You know, asking me right now to kind of give you the exact, every exact place we're working, but we are in the neighbourhood, we are in the south neighbourhood and the west neighbourhood.
Yeah, can you widen the scheme a lot more?
Sorry?
Can you widen the family hub scheme a lot more? Stopsley, Sundon Park area.
Yeah, we do outreach. We do outreach in all those areas. We absolutely do. But we can, you know, we would love to have more hubs, but we need more funding to have more hubs. You know, we don't have what we had before with children's centres. We don't have that kind of funding now, but we absolutely have a really strong outreach model. Where we run services across the town, and we engage with a wide range of partners as well. So we work with the churches, the voluntary sector, childminding nurseries. So we run services across all of those settings.
Okay, let's hope I don't have to ask the questions again. Councillor, do you want to carry on?
I'll let Alia go in first.
Do you want to go? Okay.
Sorry, my query is, what does this report have anything to do with family hubs? It's about weight management, so is there a relevance to family hubs in that? That's just a query I have.
We used to have family... the Labour Party got rid of a lot of the family hubs because of money. And we're now going back to it, and it should really be spread throughout the town. Stopsley, Sundon Park area, Parktown you now have, you're saying. So I think it's quite relevant that everybody has got to be able to get to these places.
Okay, I just have one final question, but before we move on, I think it's best that we keep it to the item that we're discussing and not politicise it, because we are talking about the welfare of the town. So I just wanted to ask you one bit on page 14, where you talk about equalities and you're talking about pathways for maternity and send. What do you exactly mean by that?
Yes, yes, sorry, concern. Apologies, I had a little bit on that in my opening address, but there's no problem. More than happy to repeat that for you. So as we went through this process of reviewing and updating the Children and Young Person pathway, we became aware of that there was a need for bespoke pathways for maternity and SEND. So although we are providing some services, we need to go a step further and understand what the needs and demands of those groups are, because we recognised on the insight work that we had done that we hadn't got as much as a comprehensive view as we would like. We would like a bit more robustness and rigour around that. So what we've done as part of this process is in terms of adopting this, we've also acknowledged that we'll be taking further steps beyond the adoption of this to then develop 2 bespoke pathways, one for maternity services and one for SEND. And that will involve us engaging with and consulting with those communities to understand what their needs are, particularly around SEND, because we feel with the changing of NICE guidance, it's given us more flexibility, so we don't have to have a structured and rigid programme to things. So once we engage with those communities like EPIC and the Parent Care Forum, that we can get a better understanding of actually what's required. Because as an example, they might say, well, generally fussy eating is an issue, so we want some resources around that. But what would really benefit us if we had more spaces for them to be physically active, or for our children to be physically active. So how can we work on making our spaces more accessible? So I like more accessible play equipment in our play areas within parks, things. So if that comes out as an outcome, we then have a very clear mandate of what we need to try and deliver, rather than us presuming that we need to do a 10 to 12 week intervention service. So what we've tried to allude to in this is that we're conscious of it's two very good opportunities for us to enhance those services and improve outcomes. And the thing around maternity is that we're very conscious around obesity playing a factor, in particular around delivery, and even in terms of conception, and how we can support expecting mothers more appropriately in terms of that, because currently the offer just isn't uptaken as much as we'd like. So obviously we've not got it right, so we need to re-engage that community and understand their requirements and what's needed and how we can get better engagement.
Be possible to get some data on that as well, because again, in terms of ethnicity and gender and so on, it'd be helpful to have some of that data, because again, when you're measuring and comparing and contrasting, sometimes you can see that there is correlation across the board in terms of ethnicity and gender, so it'd be good to see a bit more data on that as well. Just one thing as you were talking that popped in my head is, when you look at these sorts of figures in terms of weight management and so on, do you consider BMI? And if so, do you think that the way that BMI is measured is actually fit for purpose, i.e. not everyone fits in the same in the same box kind of thing? Not every shoe fits everybody. So in terms of ethnicities as well, I'm just specifically thinking of what are the things that impact certain things. And BMI is very generalised, and maybe we need to bring it a little bit closer to home. So I'm just thinking, in the way that BMI is measured, is it actually an accurate measure of people of colour perhaps?
Thank you. So certainly for the data side, we'll include that when we return to ensure we cover that off. In the sense of monitoring of BMI, so predominantly BMI is used as the standard for population level. So it's generally well accepted for that. Generally with children and young people, what we use is the growth curve charts. So in terms of the red book, they'll be put into those, which then gives us a percentile, which we work against rather than BMI for our children and our young people. Which is generally a bit more accurate for them. What we have seen, and as you say, is rightly, is it's been acknowledged that actually lower BMI thresholds present a greater risk for certain demographics, and our services are designed with that in mind. So, for example, if someone from an ethnic background had a BMI of, I think it's 27.5, had a comorbidity and things, they would be able to access service, whereas the standard inclusion criteria would be 30 for a BMI. And as we understand with the pharmacology side of things as well, I think that's something that's being explored within there. So it's certainly something that we're considerate of. I think there are better measures than BMI, which we can use. It's principally around a factor of affordability and invasiveness and how then that's measured, and BMI is predominantly kind of non-invasive and a good measure at a population level, but certainly take your point that it's not the best measure, and there does need to be interpretation included within that. Yeah.
Councillor Tilbury.
Right, I just wanted to ask, although you might have an answer for this already, I was just going through page 21 on public health and lifestyle services, and a lot of these services are open to self-referral. I'm just wondering, if I'm an Asian woman, English isn't my first language, I have no digital skills, how are you going to make these services accessible to me? Have you thought of that?
Yes, so with accessibility, obviously any health professional or anyone can make the referral in terms of some of that awareness. That's part of one of the three key themes which come out of the study that the University of Bedfordshire conducted for us. So one thing that we are looking to do more broadly, sort of away from the pathway work, is how we better communicate and raise awareness of our services locally. So that's will involve us working with Total Wellbeing around how they're currently marketing and advertising the service and drawing awareness within our communities. So they do a lot of work more broadly with kind of faith centres in different areas in terms of disseminating their information. But again, I think there's something within how we generate more of a social movement, awareness and health literacy within our communities around what services are available, what support is out there and what people can do on their own. So I say there are things in place. There is probably more of a reliance on, in terms of translation as an example, and younger family members and things of that nature being able to support. But what we do need to do is, where we do have a diverse workforce, but where we can continue to promote and drive that, how we can engage with our different community members through working with our social justice unit and the social inclusion officers around how we better communicate and spread our messages of what's available. And that's equally around putting comms out in different languages as well, in terms of understanding what's there, helping to dispel myths, as well as working with certain communities or members within the community to upskill their knowledge base so they can communicate and share messages on our behalf in terms of accessibility. So it's something where I don't feel we're at a gold standard of it. I think we do have a good workaround in terms of diversity within our workforces and things like that, but certainly with a current theme which is running through our healthy weight stuff at the moment is how we better engage with and communicate with our different communities on this agenda. And like I say, our aspiration is to generate a social movement around this where the community will take ownership and deliver that. And again, hopefully, like I say, within the delivery plan, when we can bring this back to this board, you'll see in terms of our call to action, that's our expectation of the community in terms of helping us deliver this. And these messages is to enhance that health literacy element, so better understanding within the community of what's required. And then, again, through the public health grant, we've made a small grant scheme where we can engage with different community members and influential people within the community to gain funding to then work. They can work specifically with that community rather than us going in and, putting in some intervention or some program. We can sort of provide some seed funding, if you will, to enable more activity, more things around food and physical activity to take place, whilst building our network and our reach.
No, thank you. I do understand that, but I do think having all these services available and not sorting engagement out up front isn't going to sort of, make an impact in terms of making sure we have children who are eating healthier, growing up to be healthy adults as well. The other thing is, which should have been thought up front, is about the first thing on your provision, which is better health, healthier families, where you say you'll enable families to track and monitor progress. Now, if I don't have certain level of IT skills, or I don't have the language, how is that service going to help me in any way?
So in terms of skills to track and monitor their own progress. Was that, sorry?
Yeah, the first provision on there, it says better health, healthier families. The Healthier Families link provided below includes a wide range of information to help families make small practical changes. Tools, tips and apps can be found which enable families to track track and monitor progress.
So again, to jump back on that point, that's where we need, as working with Total Wellbeing, our provider, to ensure that they are providing resources by means which are accessible to the community, and they've got those links. Again, as part of that University of Bedfordshire review, that's something that came through very strongly, is there isn't as much awareness as we thought there was in the community around our services. So it's certainly an area that's been flagged that we need to do more. Again, I completely agree in terms of the comments that you've made, that that's an area which we need to focus on.
Thank you.
Right, is there anybody else who wants to say anything or comment on anything or ask questions? No? Right, then the report is before you. The recommendation is recommended that the Scrutiny Children's Service Review Group endorse the adoption of the pathway. Do we agree to this? Any objections? No. Right. Thank you. Good.
Thank you, Chair. Thank you, everyone.
Yeah, thank you for your patience. Right, I'll vacate the chair now. Thank you all very much for your patience and keeping me here for a while. It's a very uncomfortable chair, you know.
Thank you. I'd like to record my gratitude to Councillor Keynes for covering the chair during my temporary absence. Unfortunately, like Councillor Begum, I got caught in the perfect storm of traffic all along Crawley Green Road and Hugglesby Way. As I missed the preliminaries, I'd just like to declare my usual interests of being a local authority governor of Summaries Junior School, please. And we will move on swiftly on to the next item of the agenda, which is the Children's Improvement Plan Highlight Report on pages 53 to 56 of your agenda pack, and that's with Paul Jogi. Thank you. Oh.
Actually, if that's okay, I'm going to move it jointly with Paul as the portfolio holder. So the report has most of the detail in. It provides an update on all of the improvement activity that has been undertaken between March and May 2025 and an outline of the planned activity for the next reporting period. So I'm going to go through some key highlights because you've got the full report. So under leadership, a service improvement review, which is how we're monitoring what's going on within the services, took place in March with a focus on children in need of help and protection. So the actions captured from this work have now been added to the improvement plan, and the activity has begun focusing on social work practice. So to further embed the practice framework, so that's that, I don't know, I'm sure you've seen it, the rainbow. The principal social worker has been attending team meetings and managers and discussing the framework at team meetings, supervisions and service days. Early permanency and concurrent planning and safe uncertainty training is being provided by sector-level improvement partners. Ofsted and CQC recently undertook a SEND thematic review of children not in school. So this type of review doesn't have a published or graded response like outstanding, but it provides a summary note of findings, and that will help support the development of national policy on the theme. So we've received the summary note and we're currently reviewing it for factual accuracy with system partners, and I think it will come to, the feedback will come to CSRG at some point. And planning has started for our next child-friendly Luton Schools Council. So that's leadership. We moved on to children in need of help and protection, a bit of a summary there. So we're now supporting 1,272 children and their families across family help, with 183 children on child protection plans within family help, and the remaining cases are the targeted family help space, children in need, or the team around the family. We've seen an increase in the number of family network meetings that have been taking place since the 1st of January, and we've now reached 100 of these important meetings taking place. A thematic review has been undertaken, and we're developing an action plan to support more families to utilise these networks to build family resilience. The housing allocations team have created a role of a homelessness prevention officer who will help families before they reach the point of becoming homeless, and we're recruiting an additional housing officer as part of our multi-agency team. And then just going on to children in care, so the health assessments for children in care are at a 90% completion rate. That's higher than the England average and higher than our statistical neighbours. We have a foster carer celebration event being planned for 2025. We're continuing to work with our foster carers to capture their stories to promote fostering in Luton. We're also planning events to celebrate religious festivals, accepting the diversity of our children in care. So that's not just Christmas, it's Eid, it's Diwali, things like that. Our new permanency and matching forms have gone live. A kinship and special guardianship support questionnaire has been developed to gather feedback from kinship carers and special guardians. We've also started including kinship carers and special guardians in our foster carer events so that they're getting a bit more support. A bright spot survey, so that was to get feedback around children in care, was completed, and we should receive analysis on that by July 2025 and get feedback. A life story training programme has been in place for the service to strengthen the practice around life story work, and there's bespoke manager sessions to improve the management oversight of this work. A transitions project is also now in place with children's and adult social care services to work closely together to strengthen the transition for young people into adulthood. So that was just the main things I wanted to highlight from the report. There's obviously a lot more detail, but we're happy to take questions.
Thank you. Any questions, comments? Councillor Begum?
Thank you. Sorry, I had to look around to see if anyone else wanted to ask any questions first. And I don't mean any of this directly at you, looking around the room for anyone to be able to answer. Where you got on your page 54, where you say that principal social workers attending team training to ensure practice framework, was that not happening before? Because if not, then that kind of concerns me a little bit if principal social workers are not attending such important meetings.
Well, the practice framework was revised, so what we're doing is we're making sure, because the practice framework is led by team managers, and and they're the service leads. So what we've done is we've got the principal social worker to push out, do some more discussions and sharing of the practice framework, helping social workers understand the critical detail of it. So it's just an ongoing piece of work that we're really quite pleased with. So it's really good. It's making sure it's always being thought about, because that's how we improve practice.
The reason why I say that is because obviously through past serious case histories, it's always been a case of communication and collaboration. That's always been the key points that have been raised over and over again. So that's why I'm a bit sort of taken aback that we hadn't thought of implementing some of these things a little bit earlier. Just a bit. That you want to come in, Dheeraj?
So just to reassure you, Councillor Begum, so the principal social worker has always continued to provide work within teams around our practice framework. As Paul's highlighted, we have revised our practice framework. It is a brand new practice framework which we've developed alongside our staff, and we've had feedback from children and families as well. We wanted to move away from, not just move away, we wanted to broaden out the 4C model, and we've created the relational approach to practice, because what we know is developing and nurturing relationships with our children and families is majority of the success of successful interventions with them to really drive forward change. So as a result of that, we've increased the amount of work we're doing within teams to try and embed this new way of working. And we're starting to see some offshoots of really good practice, but it's one of those things that as we have transition of staff, new staff come in, staff get promoted, it's a piece of work we're going to have to carry on doing. And it won't be we've done it, we don't need to do it again. We'll have to just keep doing continuous improvement and continuous development.
I'm just going to say, I think it's also the way it's worded doesn't reflect the fact that we're talking about a new practice framework. And I think if we're in this
children's services and we're reading it and we understand it, but it's probably not as clear to people that aren't. So I think that is probably why it's a bit confusing, but yeah.
Yeah, it's usually always about language and the way it's written. Okay, so the other thing that I wanted to pick on, where you've got on, where you talk about Makaton, is it Makaton? Yeah, Makaton training being delivered. Do you expect that to be implemented across board, and how soon do you expect that to be used? Is there any way of you recording who's using it, who's not, in terms of best practice, basically? And the other thing that I wanted to raise before I forget, because I forget things, given the fact that we are in an era of AI technology and sort of all this social media, what are we doing to train up our social workers to kind of be able to understand the narratives and the things that, and the pressure, a bit like relating back to the adolescence Netflix series thing, which is based on true story. How are we sort of, because there's things that came up even in that I thought, oh my God, I use those emojis, but it doesn't mean that to me, but clearly it's got a different meaning to youngsters these days. So again, in terms of social media, because, I mean, I work at a college, I meet lots of different adults and young people because I teach across board, and the things that I hear is concerning. And we do have a lot of children who have social workers. So I sometimes wonder, are the social workers aware of even that sort of language that the young people use, and in terms of their messaging and the way that they message, the way that it's structured, it has actually got a lot of meaning behind it, and it can, without them telling you, I'm not in a good place today, the way that they word a particular email or message to a teacher says actually a lot in terms of where they are with their mental health. So how are we kind of working with social workers to be able to pick up some of these language, not just the spoken but the unspoken as well, because kids give off all these vibes. Not everybody is in tune to sort of picking up some of these vibes. What are we doing to kind of get social workers up to date with that sort of thing, as well as the Makaton?
Okay, so if I start with Makaton, Makaton we've rolled out to not just our own staff but to partners as well, because police have got on board, and some of our health colleagues have joined us as well. I'm tracking the impact and their usage of that as partners is quite difficult, but all of our staff that have been on it, we expect to be using it with the people they support. So we are running some, I think we're running a couple more sessions on it, but that's being funded through the Pathfinder programme as well. It's finite funding is difficult, so it will come to an end, but we're trying to reach as many people as we possibly can. The social work is a brilliant challenge. I'm a father. I have a daughter now using WhatsApp and things, and it scares me. My kids went through lots of online stuff at school, so I think it's a very good challenge for us, and I think it's something we can take back. Certainly look at, have those conversations with our social workers, and if they are struggling with it, find some training for them.
Councillor Bacon, thank you. That's a very fair challenge. That digital safeguarding is one of the added triangles that is coming out through all the research and practice nationally, that we traditionally have had an assessment triangle that focuses on parenting capacity, environmental factors, and children's needs in terms of attachment, etc. But there is a new added element, which is digital safeguarding, and we are not at all where we should be and need to be because of the changing landscape. Kids are 10 miles ahead, hundreds of miles ahead of us. But one of the things what we're trying to do is we are trying to work with organizations to look at AI in terms of our practice, and actually getting to that point in terms of how do we have that different conversation with our kids, what does that look like. And a lot of work is happening in terms of our YPS, as well as certain pockets of our system. So for example, our participation through young people, etc. There is a lot of work that we are looking at, but you're right, it's not where it should be and needs to be, and it's an area that we should focus on much more, and we will have a bit more think about that in terms of being much more articulate in what that looks like.
Thank you. I just wanted to add one little bit, is there is that cultural element on top of the social media, because even when you talk about social media just in general, each person from a different background will take a different twist to it. So again, I think when we talk about social media, it is linking it back to social and cultural norms as well, I think. I think we need to kind of look at those two areas in a bit more detail. Thank you.
Thank you. Councillor Khan?
Thank you, Chair. Similarly, my question relates to the technology side of things, and I've noted that the Magic Notes app, which I think is brilliant. I've heard of it being used at different local authorities and it actually being successful. It's currently being explored for a pilot, so my question really is whether you have a rough implementation timeline of that.
Well, kind of hot off the press, really. Today, we found out we can go ahead. We've been going through a procurement exercise, so we are looking to go ahead with the 8-week pilot. So, and I've been asked to implement it as soon as possible. So, it's underway.
So just off the back of that, I think it'd be really good for the committee to hear how it's going and whether it's being well received and it's actually helping some of our social workers rather than adding on work for them as intended, because sometimes technology can make it worse.
Very happy to bring a report back once we've finished the evaluation in the pilot.
Thank you.
Yeah, absolutely. And if we could add that to the minutes to add that to the forward work plan, because it's quite a key point. Thank you. Yeah. Councillor Skeppelhorn?
Thank you, Chair. It says here that we have 410 children in care and 90% of them have had their health checks completed, which I think is a very good statistic. Of that 410, how many are in out-of-area placements? And does that make doing their health checks more difficult?
I can't give you an exact number of how many of them are outside of Luton, but I can give you that. I'll just have to go through some screens quickly to find that figure for you. But you're right in terms of the health assessments. We have worked very closely with our looked after nurse because we have a dedicated looked after nurse, and that has helped massively in making sure, irrespective of where these kids are, both in terms of their dental checks as well as their health checks, we are on top of it, and we are doing quite well in the region and nationally as well. As in terms of our statistics, we are above the averages across the piece.
Would suffice. I just rough idea of how many, but a rough percentage would be helpful.
Yeah, go ahead.
And just to reassure you, Councillor Skeppelhorn, our health nurse will still undertake the overview of children in our care. So they will take the lead responsibility even if the child is placed outside of the borough, and they'll help to coordinate the health reviews that need to take place in local areas. So we will come back to you with some information about the percentage and whether or not the 10% where there's slight delays are linked more with, I think that's your question, isn't it? Are they linked more with the fact as a result of them being placed outside of the borough? So we can come back to the committee with some information about that. Because it'll need some.
Thank you. Any other questions, comments? Yep, Councillor Chowdhury.
Sorry, just quickly, this is my first children's scrutiny, so not familiar with everything. Just wanted to know, the family network, who does that consist of?
Well, family network can be anyone around that family. So if a family becomes known to us, it could be the grandparents, it could be aunts and uncles, cousins, any close friends. Yeah, it can be anyone around that family who can provide a little bit of resilience and support and help out.
Right, okay, but because, where it says 100 family network meetings have taken place, I just assumed it might be professionals, etc. But it's professionals with the family. Yeah, right.
It's usually with a social worker in place and who coordinates and facilitates the meeting, but it's about the family that's known to us. It's about what their needs are and what can that close community around them support them with. Because ultimately, we want to build family resilience, and we're not going to do it by continually giving services to families. We need them to be part of their own solutions, and family networks, well, before social workers, were what were providing those solutions. So that's where we need to get sort of a good combination of.
No, thank you.
Any other questions, comments? Councillor Begum, yeah.
Sorry, just one other thing. Where you say on page 55, virtual schools completed an aspirational survey, was that not being done before? And do we have any data that we can look at?
Yeah, they do take place fairly regularly. So, you know, we want to, it's our care leavers and our children in care, and we want to kind of do them on a regular cycle. I can't give you any of the feedback from it, but I will have a conversation. Oh, Teresa's got a hand up.
Apologies, I should sit next to Paul, shouldn't I? It should make your life easy, Paul. Just wanted to say the aspirational survey, we could have done it earlier. It does happen frequently, but one of the things we did was we pushed pause on it because we wanted to do a bright spot survey, which is the national organisation that does specific survey with children in care as well as care leavers. So instead of doing multiple surveys and do death by surveys with our kids, what we thought, we'd get that and feed that into our aspirational survey. So our virtual school is awaiting the results. We've had the children in care last week. We're getting leaving care this week. We'll amalgamate that, and that will form part of our aspirational survey, all in time for both Mark Riddell's visit, who is the DFE advisor for children leaving care, but also for Ofsted. So that's the aim of the game.
Just one last thing. It'd be good to see that the findings of that survey and link it with the life story of the care leavers, so that we can look at where are the area or identify areas where we can perhaps make improvements in terms of services, in terms of support, and help them with their journey, because I think there are lessons to be learned. There always is when it comes to children in care. It'd be good to link those two and to do two data sets together to be able to look at what can be done to make this a lot better and a lot more robust.
I think that comes to corporate parenting board as well, just the same, unfortunately.
Okay, just a question for me actually. Just one of the bullet points under children in care was about training in place for life story work. I recall when I was going through adoption training that's really key thing to help children in care maintain their identity. I was just wondering what the improvements are and maybe more detail on that, because like I say, I think I thought it was quite an established thing.
Yes, life story work is an established tool. One of the things that we saw was that in our system, when we did our service improvement reviews, what we thought we need to get better at is that life story work that starts earlier rather than at the point of when a child is coming for adoption. That's not the time when we should be scrambling for pictures and trying to pull together their story. So it's shifting the dial in our system to start life story work from the point a child comes to our attention, whatever that looks like. Even if the end game is that the child returns back home, we're able to pull out this beautiful book that's their story, which is in child-friendly language with lots of pictures that says to them, this is what happened, and that makes sense to them. And if they didn't want to look at it, because we have some teenagers who's like, I don't want to know. So what we're doing is we're pulling it together, keeping it on file, so that when you're ready, we will share it with you. Because there are some kids who say, I don't want to know anything about my auntie or my dad. I hate them, that sort of stuff. Well, we know that could change because we need to keep those connections going. So we still pull that together. And what we've done is for a number of our children where we haven't done it in that earlier form, we're doing later life letters that are explaining to them. So for example, our separated migrant children, their stories have a lot of gaps. So what we're trying to do is pull together a later life letter that tells them this is how you came to be in this country, this is what it looked like, and this is what you told us, because sometimes those stories change because of trauma. But it's just trying to make sure this is not about anything else but their book, which is about them. So just changing the language and getting people to think differently rather than it just being focused on kids who are being adopted, because that's the traditional understanding. So it's flipping that thinking. And we have seen a massive difference in our system. There are so many pictures that come to us almost on a weekly basis because they know we get excited by it, us as senior leaders. So they show us and they send us these books, and it's brilliant. I wish I can anonymize some and show it. It's really heartwarming to look at.
Great, thank you. Thank you. Go ahead.
Would you keep that data, those books?
As long as the files exist in our system, they live in the online LCS. So as long as that child's record is there.
Obliged to remove it under GDPR?
It's their story. So when some of our, people might come to read their file as a 40-year-old and they want to see what happened to me, so it's there. We have to keep it. It's their story, yeah.
Diraj, you wanted to come in?
Yes, sorry, just to also say, I think there's a data retention policy for looked after children that's beyond, so we've got data retention policies for children that aren't looked after, but actually for children looked after, they go further beyond, but I can't remember off the top of my head. I think it's 75 years. And so our data governance team will advise us on that. Yeah, absolutely. So very important.
I hate my uncle, I hate my auntie, but 50 years down the line, it's really nice to have that.
Great, thank you. I don't see any other hands up, so I think we can consider that item covered. Thank you those who presented. I think the proposal was just to note the report, wasn't it? Yeah, thank you. Moving on to the next item on the agenda, so that's item 9, Families First for Children, on pages 57 to 62 of the agenda. And let me just go there. Is that with Paul or with you to introduce?
Tag team it again.
Go ahead.
So this is just an update on the implementation of the Family Help Service. So I think you've all had an update previously around the Family Help and the Pathfinder. So it went live across all neighbourhoods from the 1st of May. Is that date correct? Yeah. Correct. Fully. Okay, so key highlights. All transformation works are now completed, and the Family Help and the multi-agency child protection team is live across all neighbourhoods from the 1st of May. We've strengthened links with schools through coffee mornings and by allocating linked social workers and family support workers, with many schools offering touchdown spaces and places to hold child protection conferences. We provided 18 family networks with support packages, and we're undertaking a thematic review to establish the impact of those family support packages. We're also developing an offer with the voluntary sector and our shared care service to provide family networks with a menu of package options to provide different types of support. We've developed a new training package to support universal colleagues who are providing families with level 2 support through the team around the family model. We've been providing training to partners on Section 47. We have a new click data dashboard which has been developed, and it's been tested across all neighbourhoods so we can see how things are going. And the programme delivery team are actually providing sector-led improvement support to our colleagues in the Eastern region and other local authorities that are further afield as they embark on their transformation journey. So that's really us being the role models. People are coming to us to see how we've implemented the Pathfinder and learning from us, and that includes neighbouring authorities in the east of England and across England, basically. Brief summary again. The report has a little bit more information, so if you have any questions, let us know. Thank you.
Thank you. Any questions or comments from the floor? Anyone? No? Okay. Councillor Keynes first, and then we'll go to Councillor Begum. Thank you.
I don't know if I dare ask this, but yeah. What are the 5 neighbourhoods Come on, you don't know, do you?
We do, but they're north, south, east, west, central, and I think what you want is more than just saying north, south, east, west, central, blah, blah, blah. You want to know the exact areas that it covers. And it doesn't cover it by ward level, actually, and that's a point that I'll let Diraj go in.
Well, Councillor, we can share a map with you, but I don't have it to hand just now. But we're absolutely happy to share the map.
Do you know this?
I
Offhand?
don't know all the
Sorry.
words of Luton.
We know the neighbourhoods, Terry, but we can't verbalise it.
If I think Diraj wants to come in. If I could just remind people to put their mics on before they speak. Thank you.
So, Councillor Keynes, we developed the... It's me, hello. So we developed the neighbourhoods based on the school's neighbourhood model, because the most important relationship we can have with the community who see the children the most are schools, our partners in schools. So we've developed it based on schools models of north, south, east, west and central. So that's the information we used in thinking about how we wanted to develop the neighbourhoods model for Luton Children's Services.
We can provide you with the map that has the roads on. Yeah, it's just we can't verbalise what is in each. I would verbalise it as wards. If I had a script, I probably would actually. I'd go on forever.
Councillor Bigham.
Thank you. I think this is actually really useful. There's quite a few things on there that is quite interesting. One thing I wanted to kind of look at is, where's my first point? On page 60, where you've got your work stream 4 on child protection. I was actually quite pleased to see that there is a lot of work being done with the police in terms of training them up so that they know what they're looking for in terms of child protection and what the Section 47 covers. So usually we have quite a bit of a delay between police, or sometimes they're not always aware of what they need to do or what their role is within that provision. So that's really good to see on there. So well done on that. I think that's fantastic. And the other thing that I wanted to ask is, which I wasn't really too sure about, on page 59 towards the bottom where you've got systematic family therapists, you've got secondment to be jointly created between the Luton legal team and ELT. What's that going to look like?
It's a systemic family therapist that we'll bring into our multi-agency space. We want them to be a clinician. So it's a secondment in with working with ELT. And the reason that our legal team have got involved is because it's a contract. So, and it's been a journey, but we're there and we're just about over the line with it now. And so it's just to allow us to bring that person in. It was just dotting I's and crossing T's on specifications and kind of what happens if they're ill, and just really into the granular detail. But it's fantastic. They'll come into our multi-agency space and they'll be able to take referrals directly from our family help teams. So if families need systemic family therapy, we're going to have our own therapist available to them.
That's fantastic. I take it they're not in place as yet?
No, they're not yet.
Okay.
But
it's good that you got it down there, so thank you. Well done.
Any other questions, comments? No? Okay, thank you. So, again, the recommendation is to note the report, and that's duly noted. Thank you. Okay, moving on to the next item, which is the item 10, isn't it? Ofsted readiness presentation, which is on pages 63 to 82 of your agenda.
Sorry, Chair.
Is it possible to send me the link so I can put the presentation up on the screen, please?
It's in progress. Okay, so we can progress with sharing the presentation. There is a risk that when it's shared, we could lose the live stream, though. So we were just debating over that. But
what we can do is does everyone have the printed papers? So we can just we can talk through it without sharing it on the live stream.
Okay.
I don't know if Diraj has already
that's probably
done
the best solution so that we don't lose the live stream, I guess. Yeah,
So
I think
we'll
that's the
look
best
at your
way.
screen.
Thank you. Yeah.
Oh, we can put it here. Oh, you're looking at there. Okay, cool. Fine. So the purpose of this report was to go through Luton's improvement journey. I'm sorry because some of you, particularly the Labour group members, will have seen this before because I've presented on it before, but there's loads of slides, so I'm going to try and rush through it as quickly as possible so you have time for questions. Because last time I spoke to this, I was talking about it for a long time. So Teresa and I are going to just go through some bits, and yeah. So, it's gone missing. So just to give you some context around Luton is we're currently in the requires improvement space. Obviously our ambition would be to be good. For me it would be for us to be outstanding because we want the most outstanding service for our children in Luton. We have lots of opportunities and risks in general, so we are having the Pathfinder programme which brings lots of opportunity with it and some risks. We've had a few focus visits that have provided a window on the system, but we need to address practice and performance gaps at pace. We're currently in the window for the next ILACS inspection, so we could get the call at any time, and our focus over the next 6 months is to ensure the whole system is working together to safeguard and support children and families. So our vision is, sort of aligns with the 2040 vision, a healthy, fair and sustainable town where everyone can thrive and no one has to live in poverty, and that's the same for our children and our children in care. So you'll see on the slides that you've got a picture of our practice framework, which you spoke about earlier, and how that should be embedded into everything that we do. Then there's also the statistics around our proud, vibrant, ambitious and innovative town, and there's just some information there, which I won't go into now, but I'm sure you all know. I want to talk a little bit about the leadership journey. So in 2022, we had the Ofsted ILACS inspection, and that was where we got requires improvement. That had improved from the previous inspection a few years previously, where it was inadequate. After that, we had an improvement plan refresh. We had to refresh our visions and priorities. There was a recognition that the senior leadership required children's services to reflect relationship-based values and practice and values for Luton. So again, that's that practice framework. Diraj was appointed the permanent corporate director in May 2023. Then in May 2023, there was a focus visit. So a focus visit, I'm sure you all know, but just for people that aren't normally on this committee, is where Ofsted come in and look at a specific area and kind of delve into that. You don't get a grading, but it's there for feedback. So that took place in June 2023, and it focused on the MASH and our assessment. Going along into the leadership journey, so Paul was appointed the Director of Education in 2023, September. Then Teresa was appointed the Permanent Director of Operations in October 2023. And then in December 2023, you might recall that we deemed being a care leaver as a protected characteristic at full council. The previous portfolio holder had led on that. And then in terms of staffing again, we had Janice appointed as the Permanent Director of Quality and Improvement in 2024. We then became successful to be a pathfinder for the Families First for Children, one of only 10, I think. And then I took over in May 2024, and around that time is when Ofsted were coming in for a focus visit on care leavers. So the care leavers is a new judgment on the Ofsted framework. We'll talk about that a little bit later on. And from that focus visit that took place last summer, which I'm sure you all had the feedback around, was we revised our improvement plan to capture those recommendations and to assure Ofsted basically that we're trying to make changes from what happened last July, August, when we got the feedback around care leavers. We then looked at the care leavers ambition plan and we reviewed and refreshed them. So We previously had the Chief Exec, Robin Porter, as the sponsor for the Ambition Plan, and since he's left, I've taken over as a sponsor for that. So we're really trying to keep an eye on that plan. We have I can talk about this a little bit later on, but we have a Care Leavers Council that we've brought into place now, and we want to make sure that the Ambition Plan is really reflecting the voice of the care leavers. We want to hear directly from them. So we're continually reviewing and refreshing them and trying to make sure that those improvements are happening. We then commenced some service improvement reviews, which you just spoke about a couple of items ago. We updated our quality assurance framework. We're introducing practice observation and peer audits. So we're reflecting on our own work, but within sort of teams. So someone is going in and looking at their colleagues' work and that sort of getting that feedback, I think is really valuable. We updated our effective support document, so working with partners there. Then we launched our new practice framework. And then our Children's Improvement Board, we've revised it, so it's now a continuing Children's Improvement Board, because I think we've got to the point now where we know we're firmly doing what we need to do, we just need to keep doing what we need to do. So I've forgotten the name of this Children's Improvement Board person that came in. Anyway, we had someone there that had been, Ian had been appointed by the DAVs to support us with that, but he was happy to sort of let us be in charge of that, and now the chair of the improvement board is the chief exec. And then we've also done lots of work around refocusing the corporate parenting board, looking at attendees and having greater involvement of young people, but we'll go into that a little bit more later on. So looking at the Ofsted framework, Ofsted look at 4 areas. So we've got children in need of help and protection, so that's early help, that's sort of identifying and responding to children's needs and appropriate thresholds. We've got children in care, which is the second theme. So it's around making good decisions for children, the engagement that we have, helping and protecting them, health, learning, enjoyment, stability and permanence. We then got the new theme, which is the care leavers. So it's looking at everything, it's looking at the local offer for care leavers, how we make good decisions for them, and supporting them into adulthood. And then the final theme is leadership. So it's a strategic leadership. That's the leadership here that we have. It's political leadership. Our learning culture, performance management, and workforce, so how our workforce are being supported in terms of leadership. And then, as you know, the grading is outstanding good and requires improvement and inadequate. Did you want to come in here?
Just to add to that the Ofsted framework has evolved from the last time we had our ILAC. So in 2022, there were 3 criteria. Care leavers wasn't there. That's a new criteria. So it's become quite, and care leavers is a limiting judgment. So an example is Harrow Council, where their children's services got good for the first 2 criteria, which is children in need of help and protection and in care, but care leavers got inadequate, and as a result, the entire judgment was overall inadequate, and as a result of that, leadership could not get anything more than requires improvement. So it's extremely, and care leavers is a new criteria, it's not existed before, so a number of authorities are having to work really hard, because the challenge is twofold. One is that the practitioners, the personal assistants who work with care leavers, they are not qualified social workers, they are usually alternatively qualified staff, and in terms of all the amount of stuff that they have to get through for this cohort of young people is not easy. And secondly, care leavers, they are adults, 18 to 25. They can consent to how they engage with you and what that looks like. So again, with that, we have to work extremely hard, and the systemic changes for our kids in care is huge, because CAMS is not involved in the same way. It becomes adult mental health services. Housing becomes different because it becomes about housing department. So you're in a bigger pool of adult services trying to get it right for your kids. So it's not an easy one. So the challenge is systemically, what are we doing to make sure we are the best corporate parents that can be, which is not just about children's services, but about everyone else to get it right for our kids. So that's the bit that local authorities are trying really hard to get it right. So what we are doing, just to give some context, is we've asked the National Advisor from the Department of Education, Mark Riddell, to come and see how we're doing and give us some guidance in terms of a dry run, as it were. And he's coming on the 15th and 16th of July just to focus on care leavers, because that'll be really useful and that'll give us the intelligence we need in terms of how we're pitching ourselves and what do we need to do really quickly to show our best selves to Ofsted when they get here. Thank you.
So the next slide was around one and inspector calls. So it's just, I won't really go through it, but it's just how it happens on the morning and the process that goes on. I'm sure you'll be very interested to read about it. So we've got preparation actions underway. So to aid the preparations of on-site visits, there's a range of actions. So we're currently doing 6 months of audit and audit activity and quality assurance, which is taking place. We're looking at a robust comms and engagement plan, doing an Annex A review of documents, so making sure that they're up to date and how they're being actioned, so we don't just say that we're doing something, we've got a protocol in place and it's actually happening. We're reviewing our child level data and performance, we're doing our service inspection reviews that we've mentioned earlier on, and lots of self-assessment and high-level strengths and areas and focus risks are identified. We have a self-evaluation framework answering 3 main questions. So, what do you know about the quality and impact of social work practice in your local authority? How do you know it? And what are your plans for the next 12 months to maintain or improve practice? So there's a little quote here that I think is important. It's where the self-evaluation identifies weakness in practice and there are credible plans to take clear, appropriate and effective action to address these areas. So if our self-evaluation knows that we have weaknesses and we know how to address them and we have plans to address them, that is what's important. So it's not just about making sure everything is perfect right now, but it's us being aware that there are weaknesses, but that we're doing something to improve them. So progress against recommendations. Do you know?
So what we've done is we've broken the next couple of slides into key areas that Ofsted have already told us about how we are doing. So from the 2022 ILACs, I won't go and read every bit of that slide because it's there for you. But on the left-hand side, those are the key areas they've identified. On the right-hand side, within that slide, what we have articulated is all the stuff we are doing to mitigate against that and to show Ofsted that we have turned the corner in those areas that they have identified. So it's all that stuff around supervision, management oversight, making sure stability of our workforce. So for example, when they came in 2022, over 30% of our workforce was agency. Now it's in the region of 26% and it's slowly coming down as well. So we are changing and we will be able to show some growth. And again, in context of national picture, we are, the profession is losing social workers post-pandemic 5,000 per year. But for us in Luton, we are not seeing that fall in that same way. So in that context, we're doing ever so well through all the strategy we have, through our academy, etc., to grow our own social workers. So it's a hard graph, but we're getting there in terms of having more stability in our workforce, quality of our assessments for our children, right help at the right time early on. And you heard earlier some of the work we are trying to do through family help. It is about getting it right early on so that the trajectory of intervention becomes much more about early help rather than costly later life intervention that means children are in care. So overall, our number of children in care is reducing because of that sort of intervention. And consistency of pathway plans was another area. It still is an area that we're working on in terms of improving practice. The next slide is all about the focus visits. So between 2022 and now, we've had 2 focused inspections or visits. One was about our front door and the other bit was about care leavers as well, which was last summer. Again, a few areas were identified and we're doing everything we can to address through those as well. Not only that, the slide after, we're not just looking at what Ofsted have told us about us last year and the year before that, because we know everything evolves and themes and trends. So for example, what happened to that little girl Sarah in Surrey has meant that there's a huge focus on children missing education and elective homeschool educated. So again, we are evolving. So we're looking at trends nationally from other inspections, but also looking at what is coming out in terms of the recent areas of focus, serious case reviews, etc., and bringing that back into our system so that we are being outward facing as well in terms of those trends and trying to address and showcase the best in us. So those are the 3 slides in terms of what we're doing to keep our focus and track, and all of this is being tracked through our performance and improvement boards, as well as our overarching plan and service plans. Leadership?
Yep, so the next few slides are just about specific areas in a bit more detail. So we've got the little blue boxes, blue, purple, pink boxes to talk about our strengths. So, you know, we've got stable, permanent and experienced leaders, high support with high challenge culture. We welcome and invite scrutiny and challenge. Continuous improvement is business as usual, so we're not just doing it because there's an inspection coming, we're doing it because we want to improve continuously all the time. We've invigorated our QA approach and these service improvement reviews that we're doing, that we've spoken about today. We're focusing on shaping the leaders of tomorrow and growing our own, so, you know, keeping people working, providing support to our care experienced young people to get apprenticeships in-house and things like that. So it's about growing our own and keeping people, you know, local people in Luton, trying to get social workers and stuff that know the local area. We have a strong culture and diverse leadership team, which is really important because our communities are diverse, and I think that's reflected in the workforce and in the leadership, which not many local authorities have. Of course, there's a passion and care for our workforce. Committed corporate parents, so less corporate, more parenting. We all have that corporate parenting responsibility, and we're committed to it. We're strong on partnership working and open and challenging scrutiny there. We are very strong on partnership working, but it doesn't mean that things don't always need improving there, and I think we all know that. But what we do need to work on is more consistency needed in our management oversight, so reflective supervision, focusing on outcomes for children, making sure that, you know, social workers, team managers, and every step of that system, they're being supervised well and they're given that support. Like I said, more to do on strengthening partnerships. Recruitment and retention, we're doing quite well, but we need to do more. So that induction staff, career development plans, we have a social work academy, stuff like that, to make sure we're supporting our staff to stay here. And as the portfolio holder, I can say that we've had really, really good feedback around Luton Children's Services being a good place to work because of the team culture, because of the leadership. And I think that spreads. So if one person comes from another local authority and they're saying, you know, the team is great, they're very supportive, we've got opportunities for progression, we've got all of this, then that will bring other people to come and want to work here. So we want Luton to be the place to work, and I think that's really, really improvement. It's a testament to how hard the teams work. We need to strengthen learning and development, improve consistency and quality of practice. Definitely is something that we need to look at, consistency and making sure things are good throughout, not just some cases are and some cases need a lot more improvement. We need increased line of sight of practice through our revised QA framework, including our service improvement reviews and practice observations, which we need to keep doing. We talk about health and protection, so we're focused on early intervention, you know, family hubs, right children, right response at the right time. We're doing impactful work with families, focusing on feedback. Our work on children with disabilities is effective in caring, is what they found. We have collaborative multi-agency safeguarding plans, but again, I do think multi-agency safeguarding is always an area of improvement. We're working on permanence and stability, and more children are remaining within family networks, including reunification is happening and the edge of care. But what we do need to work on is about embedding the social care reforms, consistency of practice and application of thresholds. So that's going to be a theme throughout, is consistency, making sure things are good everywhere or outstanding everywhere. We need to improve our oversight and joint work with children to improve our inclusive education offer, partnership work with children who are at risk of exploitation and grooming, the direct work that we do with children and young people and evidencing that lived experience in all our work. We need to be better at evidencing and recording work done. So records, you might have done really, really good work, but if the records don't show it, you might be able to talk to it. You might be able to say, like, I did really, really good work with this child around this, but if the records don't show it, then that's the thing that we really need to improve on, making sure that those records are good. Reducing drift and delay for children that are looked after, and the timeliness of children in care proceedings, and strengthening our cultural competence within practice is important. Then we talk about children that we care for, so we have a good relationship with the judiciary and good court work. We have a very strong virtual school with good educational outcomes for our children. We have a really strong youth partnership service, working jointly with children's social workers. Of course, we have our amazing foster carers and shared carers. They're very committed to our children. At London Road, we have a service for children with severe and complex disabilities. That's by us. I visited them recently. I think they're brilliant. And the feedback has always been that they're good. We celebrate the achievements of our care experienced young people and children. I think that's really important because within our lives, within our families, when you have your families that are going to be celebrating your experience with that corporate parenting for those children in care and those care leavers and young people, and it's important that we allow them to have that family around them that they don't have or that they might not feel that they have. We have clear decision making on placements and placement sufficiency. The voice of the child is really important, so we have the All in This Together group, which is where we hear the voice of the child, children in care, and they come together and they give us feedback. They'll ask me questions. I'll visit, Diraj will visit. They'll tell us what's going wrong and what's going well, and if there's things that we need to improve on, and there's the things that we take forward. So we're getting their voice and we're taking those suggestions forward and making sure that we feed back to them around how that's working. Things to work on, we need to recruit more foster carers. This is a really big push that we need. We need more diverse foster carers. We just need more in-house foster carers. Is really, really important. So anything anyone can do to support on that. We're refocusing our corporate parenting board. So since I took over the chair of the corporate parenting board, we're working better on attendance. So understanding that the corporate parenting responsibility isn't just for us as councillors or me as a portfolio holder or children's services team, it's for everyone. It's also for our partners, it's for police, it's for health. And having them, sort of getting that buy-in from them around the fact that we're corporate parents, they're living in our town, so we need to support them in every way. And we're trying to get greater involvement of children and young people, challenging them. So one of the things that I've been very keen on is we ask that our children in care come to the corporate parenting board and ask me those questions and ask everyone else those questions and challenge us in front of everyone. And from the last corporate parenting board, what I've asked is that we have representatives from every department within the council attending those corporate parenting boards so that our children in care and our care leavers can directly question the director of housing. What is going on with your housing policy? Why are care leavers on a lower priority than they should be? Stuff like that. It's been really effective. At the last corporate parenting board, we had Mark Fowler there, we had other people there, and it really made them think, it made them change practice. It was interesting because Vicky Hawkes told me, she said to me, after that corporate parenting board, it's the first one she went to, and she then changed her practice and her team's practice after that meeting. So it's about really hearing the voice of the child is so, so important because they have much more experience and they know this way better than we do. We can study it and talk about it forever, but they know it, so it's really important there. We need to work on, again, life story work, our later life letters, more around permanency planning, focusing on that. Again, consistency of our pathway plans and our care plans, and parallel planning. Improving our transitions, again, transition from a child in care that becomes a care leaver, then a care leaver that's going into adult services more fully after the age of 25, is improving that. It's always really important. We all know, particularly as councillors, you'll know we talk about silos all the time and just making sure that, you know, housing, adult social care, children's social care, we're all working together. That's what we need to work on. And then finally, we'll go on to care leavers. So similarly to the children in care, we have the voice of the care leaver. So we have chill-in sessions, and we've recently, I just launched the Care Leavers Council. So we have a council just like the Youth Council, but it's consistent of care leavers, to hear their voice, so getting feedback on them and things like that. We also have things like care leavers that are involved in, for example, the chief exec recruitment. You know, we want to hear from young people, so they'll be part of that decision-making progress, and not just care leavers, but young people in general, but including that in them. Again, we have a strong partnership with the Youth Partnership. We've called it a protected characteristic. What I'm keen on is making sure that we didn't just pass a motion to say it's a protected characteristic, that we're seeing that we're making action from doing that. So we have care leavers as a part. If you read the integrated impact assessments, you would have seen it from the first item, that care leavers comes up. So in our integrating impact assessments, we're considering that. It's a protected characteristic. So just as much as sex, gender, religion would be on there, care leavers is included in that. We've got a mentoring programme, so mentoring our care leavers. So actually Robin used to mentor one of our care leavers, and we have people within the... Yeah, two of them actually, within the service, mentoring them and providing support, and I think that's really valuable. I guess one thing I wanted to point out is the care leavers caseload. So if you look at that the slide that I'm on under care leavers, and you see in the last 2 years the number has, I don't want to say doubled, but almost doubled, and the trajectory is going up. So where many years ago we might have had a lot of children going into care, those children that went into care, and there was a big influx of them many, many years ago, perhaps around the judgment when we got inadequate, you know, that around that time, those children are now becoming care leavers. So the care leaver caseload is increasing very, very quickly. And when Ofsted did their focus visit last year, they spoke a little bit about the caseload of our personal assistants, the PAs that support the care leavers, and that the caseloads are high, and it's something we need to work on. And it's, you know, we're recruiting, and we've recruited more people, but as the numbers get higher, those caseloads are still going to continue getting higher as much as we recruit more people. So it's just something that we need to be aware of. So the care leavers judgment is a difficult judgment for us, because again, it's not been evaluated before in previous Ofsted inspections, and it can make or break an inspection. And we have a really significant number of care leavers that is increasing, and we need to make sure we're giving them the best support that we can. And I hope that now we're having less children going into care, we will see that effect in 5-10 years' time when we have less care leavers. But now we need to do what we can with the number that we've got. So I think that graph is important. So yeah, there's things to work on. Again, suitable accommodation. So you might know that recently over at Executive we approved, so one of the things that Ofsted mentioned in their focus visit was our house banding for care leavers. So care leavers were not given priority status, they were put in band 3 for housing applications, where, you know, across the board for many local authorities they're band 2, so they have a housing priority need. And that wasn't something that we were doing, and we worked to make sure that that policy change was put into place. So care leavers now have a priority in terms of housing, which we passed that Executive a few weeks ago. Access to suitable accommodation, so our local offer, so that is us really working with our partners and stuff around our local offer. So what are we providing for our care leavers? It's not just about the council, I think it's about how are we tapping into the business sector. You know, are the local community organisations, charities, businesses thinking about our care leavers and trying to provide support and trying to provide job opportunities, apprenticeships and stuff like that for them. So it's really working together as a system. It's not just the council responsibility. We as a town, that is a really, really good community where we all work together and, you know, we all provide support. We need to show that for our care experience young people. And then, yeah, like as I mentioned, including them within the wider workforce within the council. So we actually need to start here. I can talk about, you know, Luton Rising. I can talk about the business sector and stuff like that. But I think what's important is that we within the council make sure that we're providing opportunities for our care leavers. And that's why I've said, you know, within each department, I want to see apprenticeships for care leavers, specifically for care leavers within every department, you know, whether that's inclusive economy or public health or wherever, so that we're displaying what we want our partners to do. So that's the 4 areas. Go ahead, Teresa. I yapped on for a while.
I think one of the things that would be absolutely exciting and make Luton sound and seem cutting edge is if our councillors were part of our corporate parenting board and took on the lead area. So there are 5 key areas in terms of the gold star that we want to achieve for our kids, for our care leavers, and to have that political portfolio holder, not only you, Councillor Ali, but other parts of the system being the champions. So if one of you said, right, housing is my bag for care leavers, I'm going to do everything I can to bring that challenge and scrutiny into the system and be part of that corporate parenting space, that would be really exciting. So this is my quick plug in for that. Thank you.
Yeah, I think that is something I've spoken to you guys a bit before about. Actually, I think most people in this room around that political leadership and showing that the corporate parenting responsibility is not just for me as a portfolio holder, it's for all councillors. And having those leads, you know, I want direct leads. You know, if I want directors to be focusing on those specific areas within the care leavers ambition plan, like corporate directors, service directors, officers, and then I want councillors to be leading on those areas too, and not just portfolio holders. I think it's important that backbenchers are involved and they're helping and getting involved in different areas and making sure that we can achieve the best outcomes for our children. I want our children in care and care leavers to think that we all care and that we all take it as our responsibility to support them. So yeah, thanks for highlighting that. And we'll talk about that a bit more in the corporate parenting board. I'm not going to go through the areas of focus because I think I've sort of covered that in general. And then I think we just wanted to end with our strengths. So our workforce is our greatest asset, like I've said. I think we have lots of motivated and dedicated social workers and and teams, team members, service directors, and they're really passionate about improving outcomes from children. A lot of them are local. They really care. We have our social care work academy. Our practice framework, which I've spoken about so much today, but I think it really enables us to do good work, use professional judgment. It's that trauma-informed practice I think is so important. Our partnership working, so we're working better now with our MASH, our MASA, our Youth Partnership Service, working with health, local authorities, police, education, everyone's working together better, and that is something that's ongoing and developing, and we need to keep doing it. We're innovative. We have got the Pathfinder, 1 of 10, child-friendly town. We've got Mockingbird and Foster East, and developing best practice with kinship care. So I was recently, well not recently, a couple of months ago in a meeting across that included the county around kinship carers and the support we're providing. And I was really proud to see that actually the feedback we were getting, and you know, it's taken work to get that good feedback, but the feedback we were getting from kinship carers was really good compared to some of our neighbouring local authorities. So it shows that we're listening and we're doing that work. And we have really strong leadership, you know, that support the development, passion and motivation of staff. And I don't want to think that we're only talking about our strengths. I know we've got a lot to work on, but I think it is important that we talk about those, because we have a very difficult, so the demographics of Luton, we have lots of poverty, there's lots of problems that make things a little bit more difficult than some of our neighbouring authorities that we can compare to. They might have got outstanding, but we have a very complex and dynamic and a complex, the diversity within Luton and things like that, the poverty, means that it's really, really important that we consider that within the whole picture of what's going on. And I think we're working really hard to make sure that we're doing the best that we can. So that's it. I could have done a lot more, actually. Sorry, go ahead, Teresa.
I just want to quickly end on this, that recently we had a thematic focused visit for our children with SEND, and these were kids who are not in school. And the Ofsted inspector, it was wider, there was CQC, etc., a number of different inspectors there, but the Ofsted inspector spent time with our social workers, and when she came back and fed back, she was beaming, and she said, I feel such joy in terms of the practice I have seen. Your social workers are passionate, they are a real credit to you, they know their children inside out. So what she said really stayed with us, that despite all these challenges, whatever happens, that our kids are held by the people that work with them quite well. So we've got it. We just need to make sure it's all there on the written file, on record, when people have to sit down and write. That's where we tend to fall down in terms of how do we evidence that amazing relational stuff we're doing with families onto the computer system. That's an age-old chestnut that we're trying to crack. If we crack that, then we've got this.
Yeah, no, that's great. Thanks for such a comprehensive report. And it's great to see, you know, the challenges, you know, noted as well as the strengths. I think that's really important. Any questions? So Councillor Keynes first, then Councillor Ashish, and then Councillor Khan. Sorry, Ashish. So Councillor Keynes, then Ashish, then Councillor Khan. Sorry.
At the risk of starting you off again, what's Mockingbird?
So it's not an actual bird.
Well,
It's a model. It's a model of practice. Essentially, what it is that it's trying to create a village around our children in care. So what happens is that foster carers tend to be a fostering family that looks after this particular set of children or a child in their home. Mockingbird is about having a set of carers around this particular foster carer in such a model that they are a support to each other. So it's about creating a group or a community of foster carers that work together, that they support each other, because some of our kids might display some really challenging, emotionally traumatic behaviors. It's about how can they reach out at 7 at night, 11 at night, when they're grappling with a live situation. These are people that they can reach out to who would support them, talk them through it, or maybe they can offer respite, they'll be there. So it's that sort of creating a village and a support system. It's a tried and tested model. So where it has worked, what it has meant is that these communities of foster carers, they don't have the same level of breakdowns. They don't end up having to give notice because this child is someone I can't care for because the behaviors are such, because they are feeling supported. Because a number of foster carers, their own wider family don't have the skill set to support them in the same way. They might be there to talk to them on the phone and then you can offload, but some of the actual tips or, let me show you how this can be done, that sort of active support is not the same. So it's creating that wider support around each foster carer. So they call it a constellation. That's just the language they use. So basically, if we set up one constellation with that first group of carers, we're very much at the point of launching. We've identified the lead foster carer and the community around them. We just are going through some last mechanisms to go live, and we'll be launching in the coming weeks / months. Watch this space. It's the DFE, the Department of Education. We can't call it Kingfisher or Peacock or something else.
We'll name it after you.
Thank you. Terry, does that cover your point? Yeah? Okay. Terry, that covers your point, yeah? So I'll move over to Ashish Kadia. Thank you.
Thank you so much. Really, really comprehensive. And so I think my questions are building on the fact that you guys have had a really tough position to start from. And it's specific to, if I'm really honest, in the school setting where I'd be asking the leadership of the school setting when you get to these Ofsted visits is, do you carry out a self-evaluation of yourselves, recognising this is an open forum in terms of being recorded, but it'd be prudent for me to ask the question is, where do you currently put your assessment of the services, either through the different categories or overall? And the amount of work that's going in is absolutely fantastic. With the current assessment that you've got and the need to deliver that, managing expectations of, what's that pathway to outstanding for us? I think you've described the activity. It's the timeline for it, please. Sorry, I hope that helps.
Can I say, so actually,
Well, I was going to say Rome was not built in a day, and we are building Rome brick by brick. So this is not just about Ofsted. This is trying to get it right for all our children consistently. And so we are building the absolute structure and the scaffolding to get practice right. And we are doing a tremendous amount of self-assessment. So we've had focused SIRs. I forget what the acronym stands for. Service Improvement Reviews. Thank you. It's all these acronyms, Councillor Keynes, my brain, and it's 8 p.m. So, in terms of, you're far more alert than me, Councillor Keane, I must say. So in terms of those reviews, what we've done is we've looked at certain key areas, so permanency, help and protection, children in care. What we can say is that some areas we're doing really well and we've shifted the corner. So for example, life story work, as I mentioned earlier, which was something we picked up in the permanency review that we did in December, that actually we could see that was being done at the end point and rather than earlier on. So we've shifted the gear. So what we're doing is, as we're doing these reviews, we're identifying areas and we're rectifying them. Another point is we have a weekly review through our Annex A in terms of what our data is telling us, and any anomalies we're picking up through a weekly panel where we are reviewing those children's care plans and looking at what that trajectory for the children look like and what is the end game for that. So we are doing a lot of work in terms of scaffolding and changing and shifting practice. Lots of blood, sweat, tears, muscle power, all of that. What I couldn't say is, therefore, as a result of it, definitely Ofsted will find us a certain judgment. I couldn't say that just because I'm so alive to the fact that we are only as good as our last decision. That's the brutality and the reality of social work practice. So what I would say, though, I'm quite confident that we're picking things up, we're rectifying it, and we would be able to evidence to Ofsted that we know ourselves really well. There is nothing that they would find that we don't already know. And that, I think, is what Ofsted needs to see of us as leaders, as a leadership team, as well as for you as our scrutineers, that we are telling you and we are open with you about the challenges, but also our strengths, and which is what we are saying, that we've got a bit of both in our system, and that's an open, honest system. And that's what Ofsted expects to see. They do not expect perfection because they know we are dealing with human beings, and that human science is never a perfect science. So they know that. What they will expect to see is when things go wrong, how quickly do we understand, pick it up, respond to it, and are we responsive or are we reactive? That's the fundamental difference. And the other bit they will want to see is your workforce. Does your workforce feel that they can grow here, they are supported here, they are safe, and it's a system where it's not about blame and shame, but it's about learning. If they see that sort of system, then they know that the chances are that if things go wrong, we would pick things up really quickly, or even before things go wrong, you've created a system where someone can say, hey, I feel unsafe. I don't know what I'm doing here, because that's what keeps children safe. It's not the label of the plan or the data alone that keeps children safe. So if you've got that system and conditions, so which is what the hearts and minds stuff is what we are completely working hard on. So it's hard work as well as hard work that we are shifting the dial for our system. Thank you.
Really, really comprehensive, recognise that, and yeah. I would expect, though, as a leadership team, that you'd be assessing it yourselves to potentially say, we're not good enough in this space, we need to do more. I'm not for the frameworks for just assessing what Ofsted is saying. I completely get what you are. But there needs to be a management of expectation with the scrutineers in particular in this room as to where we might land. So we don't need to have it right now and today, I think, but I do think we need to have some form of a we do need to turn the dial a bit more in this space. And then also a recognition that whenever there are financial decisions that are being made, the implications of that, so what are the risks involved in some of the decisions that are being made as well. So I promise not a criticism, it's more of a how can you get the support of colleagues and also manage the expectations of it. And you've clearly got the trust of the room in terms of leadership, so thank you.
I think that's a really good point as well that you've made around that managing expectations. I guess in the context of things, how the Ofsted criteria has changed. So the last time we had an inspection, we were requires improvement. At the moment, we haven't had another inspection, so it requires improvement. And the framework was different. And like we said, this new care leavers thing has come into it. And in other local authorities, one area has been adequate, everything else has been good, and it's been inadequate. So it's difficult for us to say, actually, we're going to get this and we think we're going to get this, because we don't know what's going to happen. It's a different framework. Things are always changing. And I don't think it's appropriate to say that. Obviously, internally, we're doing our reviews and we're making sure that these are happening, but yeah.
George, you wanted to come in?
Yeah, and just to build upon what Teresa and Councillor Ali has said, so alongside the internal reviews, we've opened the doors for external challenge and scrutiny as well. And in addition to what Teresa said, for last year's focus visit, Ofsted asked us which area would be most useful for you to be receiving a focus visit on. Whilst they can't confirm that they'll do exactly what we asked, they actually did. And one of the reasons we asked them to come and do a focus visit on care leavers is so that we could prepare ourselves for a full inspection of local authority children's services. We've also had an Ofsted inspector assigned to us as part of our Families First reforms, and they're coming and providing some scrutiny from a distance and providing some really useful, valuable feedback that's helping us shape. So we're doing stuff that's helping us prepare for better. But it would be difficult, and I think the minute local authorities use a single word judgment on themselves, it can set things off in a particular motion, which I think can become difficult. So that's my hesitation. But I think on day one when Ofsted come, they're likely to ask us where we think we are, and we will have to have a better answer.
Yeah, so just you've given me a lot of confidence in your answers, so I just want to reassure you on that as well, so thank you.
Thank you. Councillor Khan?
Thank you, Chair. Well, actually, my question's been answered, but so I suppose I could just say that actually it's reassuring to know that actually the things that need improvement are being recognised and that is being worked on. And thank you so much for the comprehensive report. I think it was presented very well. But like I said, the question's been answered around what we are expecting, and I think it's just to say I think it's sensible to not comment on that at this stage. Just because we don't want to set ourselves up for something we don't want to, or whilst it's good to be aspirational, I suppose it's always really difficult, especially with the new framework. So I just wanted to say well done on the work that the department's doing, and it's really, really good to not just hear about the good stuff, but also the stuff that needs improvement and the work that you are doing to work on that. So thank you.
Thank you. Let's see. Councillor Begum.
Just wanted to ask a question with regards to. So, where you talk about recruitment, you're getting better at recruiting and retaining social workers, which is good. What are you doing in terms of? Because I've heard some bits and pieces from a few people in terms of where they've asked to join like the social work program, but after repeatedly trying to reach out and get some information on how they go about the process, and these are internal people, they've not heard back. So what are we going to do about getting better at communicating to those people that internally are interested in going on to social work? They work within the Department of Children's Services, and they are interested in going into social work and kind of taking up the training. However, one person in particular is agency staff, is not directly employed by the council. So we're always saying that we want to train our own, keep our own, but then we're kind of fobbing some off by not getting back to people. So what are we going to do about that?
Diraj, yeah.
So can I just check, Councillor Begum, is this about the social work training programme that you're specifically asking about? So we have a number of different routes. So we have the Frontline Academy, which is our frontline unit, and we're expanding that to double the size from this September. So up until this year, we could have 5 students go through the unit. We're doubling that to 10. We've also had the Step Up to Social Work programme, and we've had a range of staff that have stepped up from being alternatively qualified to going for their social work qualification. And then we've also had the apprenticeship opportunities to come through that route. And then in addition to that, we will also take on newly qualified social workers coming straight out of university. And of course, our experienced social work recruitment program carries on as well. One of the things we have to be mindful and careful about is not to saturate our system with students and newly qualified staff. We need a good proportion of experienced staff because we know social work is complex. And with newly qualified staff, although they come with amazing energy and some fantastic ideas that they've learned from, you can't underestimate the value of experience. So we have to balance that a little bit. If I could ask that you just share the information about the individual member of staff, if they're willing for you to do so, Teresa and I can take that back to the department and just see what's happened in this situation. But I do know that this year we've had to look at the numbers that are coming through our Social Work Academy, just to make sure we've got efficient and sufficient number of managers being able to support them.
That's good to hear. I mean, that one particular person has been trying for a while and not heard last year, tried again this year. And I did actually suggest, why don't you get in touch with Frontline directly and see what comes about. That was my suggestion to them. So I'm not sure, that was a recent conversation, so I'm not sure what happened there. But the other thing I wanted to ask about, where you talk about focus training on page 74, that you're continuing with focus training for frontline staff to sort of do the analysis and assessments and writing up assessments. Who are these frontline staff? Are they quite new, or are they not familiar with sort of writing up assessments, or is this specifically talking about people that are coming in new that you're training them up? Or I just wanted to know a little bit more about that.
So as we're implementing reforms in particular, we've expanded our training offer, because so one of the things that's changed as part of the social care reforms is that assessments, statutory social work assessments, can be undertaken by alternatively qualified staff.
Right.
So we wanted to expand our training offer to make sure that they have sufficient understanding around the statutory implications for social care assessments and to hold child in need cases. However, it's really important that we offer training across the board, because continuous professional development is so crucial as part of the social work programme. Things change, and I think you picked up earlier on in today's scrutiny, the world is changing around us. Young people are being exposed to different kinds of risks and some great opportunities as well. We need to make sure our assessments are up and developing in that way, and therefore training.
Okay. The other thing I wanted to kind of ask about, where you talk about including the child's voice. I mean, is this something that, I know we always talk about the child's voice, about making sure that the child is heard and actually listened to properly, because there is a difference between hearing what somebody says and actually listening to the words and the meaning behind the words that they're saying. So how are we going to be improving that? Because, I mean, you've mentioned the voice of the child quite a few times. I know it comes up quite a lot in the corporate parenting board from when I was on it, not last year, but the year before. So how are we looking to improve including the child's voice and making sure that the interpretation is as accurate as it possibly can be?
Yeah, so some of the ways that some of what I discussed in there are that All in This Together group, our chilling club. So we're hearing directly from children in care and care leavers, not just the ones that are coming to corporate parenting board, but we're getting feedback from them. We've got the Bright Spots survey that we just spoke about, that we're going to get from July. That's more of a official way to collect that data, and it's a national thing that we can compare. So once we get that feedback, we'll reflect on it. I think for me it's really important that we're not just collecting the data, we're actually actioning it. And then there's also other ways that the voice of the child is listened to, you know, the direct work that they have with the social workers, how they're talking to to family support workers, to their PAs and things like that. So it's interesting, it's something that I've been talking a lot with Diraj and the team about, is making sure that that voice of the child is there. And I do feel confident that we're doing what we can. We can always do more, because we're not getting the voice of every child. We're getting the voice of a select few. But we have a brilliant team within Children's Services that work on those areas. So, for example, the All in This Together group is where they get together after school and they go through games, they have a bit of food, and within that they have the opportunity to give some feedback, to talk to us. It might be the people they're directly working with, it might be people that, like me, that they probably never saw before. And we're always open to, particularly for our care leavers, you know, the Care Leavers Council, we're getting views from them and we're asking them, we're getting the PAs that support the care leavers to give their views to us. I've always said they can email me whenever they like. So it's getting that. And I do think there is some value in us mapping that, how we're getting that voice of the child well. That's something that I've been thinking about recently, to make sure that we're displaying that we can do that, because it's come up before. So yeah, it's a work in progress. We're working on it. It's definitely improved. I think that corporate parenting board and having that direct, you know, there's only a few young people that come to it, but we're getting feedback. They're giving the feedback for many people. So yeah. Go on.
And just to also add to that, what we're also doing is we're looking at, through our audit process, the business as usual audit, we reach out to the kids as well. So as an auditor, I would pick up the phone and speak to a child. And if they are younger children, what we do is we look at the visits record to see how so where every social worker, when they visit, they come back, they write it up. We try to see how have they captured. So what we're trying to shift, and it's very interesting. So we had a kid who said, don't keep asking me what I ate or what my favorite pasta is, when actually I know there's domestic abuse in my house. You can talk to me about that. So it's about how do we get people to think, have brave conversations and not to worry and skirt around with spaghetti and whatever else. So it's that kind of giving that feedback back to the practitioner. This is what the kids said. We also have expert by experience who come back into our system and talk. So for example, on the week of 14th July, we have practice week. And as part of that, we also have one of our own kids who's gone through the care system, is now a social worker in another part of the country, but she's coming back to talk to us about what that was like for her and how well we'll be in encouraging her to speak in her voice, and how did we help shape her. So I think those sorts of things, stories land better with people. So it's using stories to get people to think about how are you writing about this to your child, and getting people to think differently. And it's even little things like we have chronologies that we put in our children's files, and what we say is, as a parent, I know when my child learned to ride a bike, and you make a note of that, and there's a picture. Do that for these kids too, and put that, on this date you learned to ride a bike, well done. And just mark that, take a picture, share it with them, but put it on file. It's about being relational in that thinking, and you can just see when you talk like that, the penny dropping in people's minds that, I see that, I can do that. Because people think something about putting things on a computer, you have to become very formal and go, dear Mr. Deerish, da 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 da. That's how they see it as, rather than, Deerish, this is what happened today for you. Sorry. Yeah. But I think it's getting people to shift their thinking. So it's work in progress, but we are getting there. There's some lovely examples in our system that we can see, but we are capturing that through our audits as well.
Can I give one example? Like, for example, I don't know if you've heard around I don't know exactly what it's called, the no black bags. So
My Things Matter.
That's it, the My Things Matter pledge. So the children in care gave the feedback that they're going from foster placements, or they're going around, and and their stuff is going in black bags. And from that feedback, the My Things Matter pledge, now we make sure that no child in care is going from home to home, or wherever they're going with black bags. They're going with suitcases or bags, or real bags, not black bags. So that's like an example of how we've enabled that change from hearing from them. And that's really important. It's probably something no one would even think about. What are they using to transport their stuff? But from hearing that, we thought about it, and that's changed, and I think that's had good feedback as well.
That's really good to hear that example, because you associate black bags with rubbish, and obviously looked after children feel like they're already that rubbish or that dirt that people are trying to get rid of in society, and they don't have that sense of belonging. So it's good to hear that you've made that shift from black bags to suitcases. So I'm very, very excited to hear that. I'm really pleased to hear that. So well done on that. Just want to ask two quick points. One very quick point, timelines in terms of assessments. What do they look like now, or what? Because you say that you've improved them. So what do they look like now in terms of the improved version?
Yes, so our average timeliness of assessments is 29 working days. The actual time frame we have is 45. So we are ahead in that regard, and we are ahead both in terms of statistical neighbours and England averages. So we're doing quite well on that. And timeliness of assessments, which is the overall time taken, is 29. But in terms of the percentage that we're completing on time of all the assessments that we're doing, the entire cohort, we've got about more than 89% are on time. So which is done under 45 days. Does that make sense?
is that initial assessments or is it sort of...
No, these are single assessments. We don't have an initial or this is just one assessment done by our practitioners, whether you're alternatively qualified or social work qualified. This is the assessment that is, and what we're trying to do is assessment is intervention. So go have that conversation, but as part of that conversation, start having that relational conversation that makes change happen, and so that we're not waiting for the end of the assessment for things to fall into place for families.
Thank you. Just one last thing in terms of sort of, because we're talking about the whole process of looked after children, the processes, the experiences and capturing all of that. I'm just thinking in terms of obviously Ofsted, what they pick up, because they obviously look at how a child is doing in school as well, if they're a looked after child, and what that looks like. I just wanted to know, because this is my own personal challenge that I've had, because I've got a year 10 child, work experience. Finding work experience has been so challenging, because obviously parents are asked to kind of look for the child, or the child is responsible for finding their own. What does it look like for looked after children, or are they guaranteed a work placement place?
Our virtual school, our virtual head will do everything. So please, in terms of if there are looked after child or whichever looked after child, every authority has their own virtual head. And that's something that we will aggressively persevere for our kid. So please do let us know about this child, because I'm keen that we get that right.
I don't know of a looked after child, to be fair, who's had any difficulties with that, but I'm just wondering in terms of how are we sort of supporting them, because just as an ordinary parent, I found it very challenging. It's been very stressful for my son even to find placement. So it's a case of if it's that difficult for an ordinary 15-year-old to find a place for work experience, how are we supporting looked after children to find that? Because then they're at an increased risk of being targeted and groomed and so on, because obviously they're not going to be in school. They probably or should be at home with foster carers or what have you, or should be at the school doing something, but they may not turn up on time, or they might be late, or do you see what I'm saying? So I'm just thinking of the safety aspect of that young person. What are we doing to help them make sure that they have a place secured early enough for them to get their head around, okay, I've got to do this, this is where I'm going between these dates, and this is how I'm going to get to that particular work placement, and like just basically how are we going to support them through that?
Yeah, that's definitely part of our virtual head and virtual schools. So they work very closely with the social work team and PAs as well for our 18 plus to get our kids to the right place at the right time. So absolutely, yes. I won't say it's easy in terms of getting kids up and out of bed, etc. But we are not, we have instances where practitioners turn up at the house and say, come on, love, get up, we're going to go, and drive them in. We've had instances where, they're having a conversation and one of them shared with us, especially during the SEND inspection, they shared with the Ofsted inspector, we were having a conversation and this young person said, yeah, no, I'll give that school a try then. She said, come on, let's get in the car, and drove her right there and then, enrolled her, did everything right there and then, struck when when the moment was right, and got in, and that was it. This kid started attending and made sure that, so we are doing that a lot, absolutely, and that is the brief of our virtual head as well. That's the absolute focus for them to get the academic achievements right for our children in care and care leavers.
Diraj? Yeah.
Thanks. Thank you, Councillor Begum. So just to build on what Teresa said, we have a Care Leaver Ambition Plan that Councillor Ali mentioned about earlier, an entire work stream of activity around improving employment opportunities for our children in care and care leavers. For children who are in care, our foster carers are passionate about identifying work experience opportunities where they're struggling. The social worker, as part of this Children Looked After review and their Children Looked After care plan, there's an entire section around sort of what happens beyond my schooling and my education. That's their plan, and that will identify key steps and key areas where the council can support. As they transition into becoming a care leaver, They have what's called a pathway plan that's completed by their personal advisor, the care leaving personal advisor, with the young person, again looking at opportunities for employment, training. What do we need to do to get you into that place where you've transitioned into a self-actualizing adult? So there is several ways in which we do it. Within the council itself, we need to do more. I will absolutely say this. We have the opportunity, we're a business and this is our family. Yeah. So we need to identify more and more opportunities. Councillor Ali has said she wants every department to commit to opportunities for our care leavers. Let's go, let's do it. These are our children. We've got a responsibility towards them.
Thank you. I'm aware that we're running quite late into the evening, so perhaps one question from Councillor Skeppelborn and then we'll move on.
It's more of a comment than a question, but ever since I was elected back in 2003, every budget round has focused on we can't keep people we've trained. Suddenly you seem to have been able to do that. Can you please train the rest of the council on what it is you've done to achieve keeping social workers from being poached by those nasty boroughs in London who seem to be picking off all other people that the council trains, and then suddenly they disappear. And you've suddenly found a way of keeping social workers.
It's their charm.
Unless you've chained them up somewhere, how are you keeping them? And can you train the rest of the departments what you're doing?
I think I can answer that. There probably is still people being poached where local authorities pay more. But I think feedback goes a long way in the social care sector. So when we have, I mentioned earlier, like when we have a social worker that's moved here, I don't know, from somewhere in London, and they have really, really good feedback, and they know they've got that support, they've got good management, they're being supervised, they've got the social work academy if they're newly socially qualified. That feedback spreads, and then they bring more people with them. And then they stay, and if within circles, it's like in any sector, if you know that this is a really crap place to work at, I'm not going to apply for a job there. But if someone said to me they're really, really good, and they might not pay as much as London does, but they're going to give you that support, they're flexible, you know, they really care, then you're more likely to go to that work. Well, I know I am. So I think that is just a testament to how hard the team has worked, management has worked to get that culture changed. And I think over the last few years where we've had a massive change in leadership, that's sort of translated down. But I won't say that it's, you know, people still leave, they do, but I think that is a really big strength, and I think as time goes on that will only get better, and we'll get better at recruiting and retaining. So yeah.
Yes, because also one of the things was consistency of social workers was something that the looked after children were seriously complaining about, is they never saw the same person twice. And that doesn't help them. So the fact that you're keeping them, for the most part, is a good way forward of improving the service to looked after children that the council is giving. And I'm pleased to see that is happening. And I hope Ofsted will see that as well. Because I'm not a fan of Ofsted. Having been a school governor on 3 schools that had Ofsted inspections, I'm not impressed with them.
Thank you. I don't see any other hands up under that item, and again, I think we were noting that report, so report is noted. Thank you. Moving on to the final agenda item of the agenda, which is the forward work plan. Let me find it. So, page 83, thank you. So we've got, where is it? Here it is. So we've got Luton Youth Justice Plan, which is coming here before going to executive, I think, in September. Infant and maternal mortality analysis drug and alcohol service re-procurement, and Luton Care Leaver offer. So those are the 4 items for the next meeting. Obviously you've got the other 4 items for future meetings as well, which we will add and move as we need to. I'd say, given time, if anybody's got any comments or suggestions, then please do drop me an email. Otherwise, we'll finish here. Thanks everybody for your input and patience, especially considering my lateness. And I'll see you next time. Thank you.